Hello everyone, my name is Chandler Pafford and I'm a pharmacist currently working at the mall in St. Anthony, Consumers Pharma Choice. Originally from Black Duck Cove, so not too far from here. And I have the pleasure to present to you today on behalf of my Pharm D program. I'm trying to get my doctorate in pharmacy, and so this is why I'm doing this presentation. So again, thanks to all you guys here for allowing me to present, and let's begin the magic of deprescribing PPI edition, presented by myself, Chandler. So, something in the news recently, as many of you guys may have heard of, ranitidine, Zantac, was recalled recently. The reason because of this was there was a potential cancer-causing agent that was found in ranitidine tablets. That's why it was recalled. And so, a lot of people who were taking ranitidine to reduce their stomach acid because they were getting heartburn and whatnot, had to be switched to new medications. And some of you may have also experienced this. They stopped, they changed ranitidine to something else. And something a little more closer to home. Have any of you noticed that you find you're getting more colds recently, maybe more pneumonia, something like that, more coughs? Or how about this? Have any of you guys had hip pain, knee pain, or potentially had a fracture that you may not have had before? And let's also go to these. As you can tell, there's 3 medications. The top 2 are vitamin B12 tablets. I don't know if any of you guys are taking those for low vitamin B12. And the one on the bottom is a magnesium oxide tablet for if you have low magnesium. Now, what would you guys think if I told you that the reason that you may have had a hip or a knee fracture that you may not have had before, or that you're having more colds lately, or that the reason you're taking these medications is due to the fact of the medication you're taking to reduce your stomach acid? So here's our learning objectives for today. So we're going to describe deprescribing, and we're going to define what a PPI is, a stomach acid pill is, and what it's used for. We're also going to discuss the risks associated with long-term use of these medications. And finally, we're going to come up with some strategies in order to stop using these medications to successfully deprescribe them. So, what is deprescribing? That's the first thing to talk about. Well, obviously, it's the opposite of prescribing. So, when you prescribe a medication, you're given a medication. You've been prescribed antibiotics, maybe blood pressure medications, things like that. Deprescribing is the exact opposite. It's where you stop taking the medication. It involves a person stopping the medication instead of taking one. Hopefully, you go from this, with all these medications, to this, with only a very few. Because, as with anything, the less medications that you require, the better. So, some examples of deprescribing. One example is stopping amitriptyline if it causes too much dry mouth. Amitriptyline is that medication there at the bottom, that left one. A lot of people take it as a sleeping medication or a pain medication, but also causes a lot of dry mouth. And because of this, we sometimes deprescribe it. We stop it because it's causing too many side effects. Another one is stopping a cholesterol medication, like a atorvastatin, this one on the bottom right, or rosuvastatin, because a lot of people find it causes leg cramps or muscle pain, and if it's causing you too much muscle pain, we have to deprescribe it, take it away. Another one is stopping sleep medication after it's no longer needed. Like after you've used sleep medication and you find you're back to your normal sleep schedule, we deprescribe it or take it away. Basically, deprescribing is when we stop the medication when the risks of using it are more harmful than the benefits of actually using the medication. So, what are PPIs? What's the drugs I'm talking to you today? These are stomach pills or acid pills. And what they're used for is to reduce the amount of stomach acid in your system. Because a lot of people get heartburn in that, and by reducing the amount of acid in your stomach, it reduces the heartburn. Used to treat a variety of conditions: heartburn, H. pylori infection, and ulcers. So, some examples. I'm just going to put some on the screen. First one there is Pantoloc, Pantoloc or pantoprazole. Some people might take that. Second one is Nexium esomeprazole. The third is omeprazole, which is Losec. And the fourth one here is ranitidine, R20. A lot of people take this one. Not ranitidine, rabiprazole. Sorry, I was wrong about that. And that bottom one there is Tecta, pantocrazole magnesium. And finally, the last one is Prevacid. So these are some examples of the stomach acid pills that I'm talking about today, and the ones that hopefully we'll talk about deprescribing. So, standard treatment. How are they supposed to be used? Once daily for 4 to 8 weeks. And then, ideally you want to take it before breakfast because they're best absorbed on an empty stomach, so before you eat. They should not be long-term medications. After use for 4 to 8 weeks, you're done. Except for people taking some long-term painkillers like Celebrex, stuff like that could hurt the stomach. And should only be taken twice daily when treating certain conditions, not heartburn. But if you got an infection by a certain stomach bug, you should take these twice a day. So why are they given so often? Very little short-term side effects. Headaches about it, though some people do get nausea initially. Really, really effective. They're really good at reducing stomach acid. People find some work really well. And finally, for a long time, we didn't think there was any long-term side effects. Because when you test the drug, you normally only test it for 2 to 3 years. You give it to people for 2 to 3 years, see what happens. And all the long-term side effects I'm going to talk about today, usually you need to take them for 5 years or longer. And most are pretty cheap. Like even without insurance, they're pretty affordable. Some exceptions, are Nexium and Prevacid. So, why do we want to deprescribe these? Why, after you start them, do we want you to stop? Associated with several long-term side effects. They have quite a few side effects if you take them for a long time. They increase the risk of hip and knee fractures. They increase your risk of pneumonia, and they also increase your risk of infectious stomach bacteria. They reduce vitamin B12 levels. And they're also associated with kidney damage. They can hurt your kidneys if you take them for a long time. They can interfere with some medications, because some medications you may need to take actually need you to have an acidic stomach to take. And also, they increase the cost to both yourselves, patients, and also to our healthcare system. Because if that's another drug, it's another drug someone has to pay for, and the less drugs required, the better. So, how to deprescribe a PPI? That's the question of the day. How do we actually deprescribe them? Honestly, there's many different ways, and no way is the best method. The best method is whatever works for you. However works best for you to get off these medications is the best way. So, the first way we can do so is having the dose. So say you're taking rabiprazole 20 milligrams a day, you go to rabiprazole 10 milligrams a day. The problem with this method is these medications can't be split in half. Like I know some medications guys may be taking can be cut in half, you can cut the pill, but these can't, because if you do, they don't work. So they require a brand new prescription from your doctor, which makes them a bit inconvenient. And have the dose for 2 to 4 weeks and try to discontinue altogether. And some people, if you're taking these medications for reducing your stomach acid twice a day, try dropping down to only taking them once a day first. So hopefully we go from taking R20s and instead going to R10s. The other is taking a tablet every second day instead of every day. So this is a good method because it doesn't require a brand new prescription. All that needs to happen is you take 1 pill one day, the next day you skip it, and then go on from there, again for about 2 to 4 weeks until you're finally done. And could result in more reflux during your off days because, again, you don't have any drug in the system during that day. So that's something you gotta watch out for with this method. And the final main method is shown there, cold turkey. Oh, excuse me. Sorry about that, guys. The computer's kinda out on me. Stopping immediately, cold turkey method is where you just decide, okay, I'm just going to take today, stop it completely. Problem with this method is you're most likely going to have reflux for well, 1 to 2 weeks, some people say, but really you're only going to have heartburn for maybe about 1 week, then it goes away. That's because where the drug's no longer in your system, your body overcompensates at first. It makes your stomach more acidic than normal, but as it gets used to not having the drug in your system, that goes back down. It will go away. Even if you feel the heartburn for a week or 2 after, it will go away if you stop. So, now the big thing also, when trying to stop these medications, is there's a lot you can do yourself, lifestyle-wise, to try to make it easier when coming off these. First thing, of course, avoid foods that trigger heartburn. And the first food to avoid is bad for myself, and I'm assuming a lot of other Newfoundlanders, fried foods. I love fried foods, I love chicken and chips, but they're bad for heartburn, they're bad for GERD, so we gotta stop that. Well, not stop, but have less often. The other one is peppermint. Again, this one's bad for me because I'm gonna be honest, I can go through peppermints like they're candy. But this is something that can actually make acid reflux worse. Even though it doesn't really seem like peppermint would cause heartburn, it can. Also, coffee. Again, I'm just listing all the foods that I'm bad for. I should watch myself for heartburn, but coffee, decaffeinated or caffeinated, it can be bad for you. Tea, not so much. So if any of you guys are coffee drinkers, maybe switching to tea would also help with heartburn.
I'm not switching to tea for sure.
Yeah. And the final food that may cause some heartburn is spicy food. So anything with hot peppers, chili, stuff like that. Eat smaller meals more frequently. So instead of eating 3 big meals, like just having breakfast, dinner, supper, still have them, but make them smaller. And in between breakfast and dinner and supper, have a little snack. Because the more bloated you are, the more food actually in the stomach, the more heartburn it can cause. And finally, no foods within 2 to 3 hours of going to bed. Because, when you lie down, if you lie down flat, where does all the food in your stomach go? It doesn't stay down here, it goes back up. And that's why some people get heartburn at night. So that's another thing. Just when you're gonna go to bed 2 to 3 hours beforehand, no food. Water and stuff like that's fine. Even then, something bland like maybe some bread, something like that probably won't be so big a deal, but just watch out for that. And also something to think about is smoking cessation. Smoking is bad for acid reflux. So that's something to think about. And as a pharmacist, I can help you with that because I can actually prescribe prescription medications to help with smoking cessation now, without having to go to a doctor.
Yeah, when I'd have done that, I hate smoke more than it was out there for 2 years, but I did.
Nah.
Ain't eat for nothing.
What did
I said, Hank was out there and tablets and that. Please,
Oh. What to do if you have trouble stopping completely? Because honestly, you can put all these lifestyle modifications to effect, reduce your dose, everything, and still you may have some reflux. So what to do if you still have some symptoms? One thing is just taking half the dose, getting your prescription changed, so instead of taking the dose you are now, dropping it back down to half the dose. Because the less dose you have, the less chance of side effects. Switch from a PPI, which is the one I was talking about, to a non-PPI acid reducer. The big one, of course, is Zantac ranitidine, which was recalled, but it's actually back now. They got rid of the ingredient that caused the recall, not in there anymore. And another thing, kind of as an aside, there is another medication similar to Zantac, famotidine, Pepcid, that you could try, but the Newfoundland government doesn't actually cover it. They cover the PPIs and ranitidine, so it makes it harder for people to get because, medication's not covered. It's really harder for people to get put on. So if you want to talk to your local member about getting Pepcid or famotidine added to the Newfoundland drug formulary, so it will be covered, that's something to think about. And also, you can switch to a stop and start method, is what they call it. So, you have your stomach acid, like you get an episode of reflux, an episode of heartburn, it happens. So you take your heartburn medication for 2 to 4 weeks, then stop it. Because a lot of these side effects, the ones I was talking about earlier, they only happen if you take your medication for 2 years or longer in a row, like once a day. Okay, so in conclusion, PPIs, these stomach acid reducing medications, do have a definitive place in therapy. They're good drugs. I'm not saying they aren't good. I'm not trying to say we should just burn all these drugs, throw them away. No, they're still worth it. But as it stands there right now, they're definitely being overused. They're definitely being overused. Deprescribing PPIs, these medications, is something that needs to happen more often. And also, this is less for you guys, but more what I'm trying to talk with physicians and other prescribers about, is that when someone is prescribed these kinds of medications, they should be like put under the assumption that it's only going to be short term. You shouldn't be, first time you're given these medications, given a full year prescription. So, I just want to put a quick plug out to this group here, Safer Meds NL. They're a group the government put together to try to stop overuse of medications by trying to help people get off medications that are probably doing more harm than good. This class was one of them, and they're still doing that now. And they got a lot of good resources for helping out. And another thing is, now they're in the phase 2, which is trying to help people get off sleep medications that they may no longer need. So if you guys want any resources or any pamphlets, stuff like that from them, either I can like get them for you, or I can find someone who will. And these are my references I used for today's presentation, and thanks a lot, everyone.